We are the acute mental health trust for Dorset, but actually we are so much more than that in the physical health side. And what we're really wanting to look at here is what our services are and what are the sort of things that, research-wise, that matter to the people on the ground who are actually seeing the patients. And also a little bit about how we can leverage all the information that we've got to help with research. So, not just a mental health trust. I gave this talk initially to the Consultants Away Day because actually the majority of consultants at Dorset HealthCare have no idea of all the services that we do and the work that we do. So this is a list of our services. These are the ones which theoretically I have responsibility for, and even I sometimes find difficulty putting it all together. But in a bit more detail, we work out of 300 sites. That makes it really difficult to get messages across because you're actually working with lots of different people in lots of different areas. The rumour mill works fantastically, but actually getting real information out there is difficult. We cover the whole of Dorset. We integrate with multiple different services, and we've now got a research unit based in the Linden unit in Weymouth. So community hospitals. A lot of areas have moved away from the community hospital model. We still think it works. We use them as our P2 beds. We've got 8 community hospitals with 208 beds in those, so that's a lot of patients we've got there. And we use them primarily for step-down rehab. Patients coming out of hospital aren't ready to go home yet, need a little bit of polishing before they're well enough to go home and care for themselves. But also, more importantly, we do a lot of step-up work. So we're working with that care into the community with the virtual wards so that patients who will be damaged by admission to an acute hospital because of the necessary environment when you've got 50, 60, 100 patients coming through your EDs every day, that doesn't work well with the frail elderly, we actually give those patients a much quieter environment to treat them. But we can still treat them with treatments that are not necessarily readily available within their own homes. We also have some day surgery and endoscopy units in there as well, and we do a lot of end-of-life care, which is vital because one of the things about end-of-life care is you've only got one chance to get it right, and if it doesn't go well, you can never do it again. So it's really important. What are the sort of things we think about? Hydration, nutrition. Sarah knows very well I'm very passionate about nutrition. If we don't get nutrition right, nothing will work. If the dental care isn't right, people aren't able to eat properly. If we don't have good nutrition, none of the primary health care work is going to work. And the deteriorating patient. How do we work out when the person in our hospital actually needs something more acute than we can do and get them transferred to the right place in the right time for the correct treatment to be given to them. We have the virtual wards. I've actually been running a virtual ward in Weymouth since about 2015 with the great Riaz Daramshi, but a lot of the things we were doing then are now becoming much more popular and are really important. We're running mainly frailty virtual wards, but we are combining with the acute hospitals, particularly with Hospital at Home from Dorset County. We're starting to work more closely with UHD, but we're looking to see how we can work with the cardiac and the pulmonary virtual wards. We have 3 consultant frailty practitioners in Dorset North, West and East. So we're also looking at new staffing models. We're looking at ensuring that people's careers have development, have new areas that they can go in, because that's so important for recruitment and retention. But important to us really, telemonitoring. How do we ensure that patients who are at home are getting the right level of monitoring, that we can ensure that they're getting the care that they need when we can't visit them by just popping down to the ward because they may be right the way across Dorset. Polypharmacy, massive problem. I spend most of my life de-prescribing medications rather than prescribing medications. We see so much in the way of pharmacy cascades where you give a medication to treat the side effects of the medication you've just started. And if we can get that right, we're going to save so much money and we're actually going to make people's lives better. Hydration, again, is so important. Falls, urinary tract infections, delirium, all these things that where hydration is so important. So the hydration toolkit that's come out of Bournemouth University and the Wessex HealthCare as it was, very important. And again, managing deterioration. We run the 111 and CAS service, so we provide primary care services to all of the people of Dorset outside of normal surgery hours. This is a massive undertaking. They're taking something like 600 calls a day. It's a very high-risk area to be working because a lot of the contacts with patients are taking place over the phone. You get very limited information, and again, the wrong advice can give disastrous outcomes. We're one of the few services that has 111 and CAS joined up together, and the reason we do that is you can get so much more information. We use System 1 in our community hospitals, we use System 1 in our virtual wards, we use System 1 in our CAS and 111, and all of the GPs across Dorset use System 1 as well. That's a massive amount of information being collected on one computer system. We have a visiting services that GP does GP home visits, and also we work very closely with the ambulance service, not only taking patients who aren't well enough to be at home, but don't really need to be in an acute hospital, but also validation of calls, so that we're trying to help the ambulance service manage the vast number of calls they get by ensuring they get the right service. I've got a minute left, so I am going to have to go quite quickly through the rest of our services. Unplanned cares, we have MRUs and urgent treatment centres. So again, we're managing all of the out-of-hospital ED work. Specialist outpatient services, we've got the MSK, community pain. Those two are starting to work closer together because MSK and pain are intimately joined up. And programs around pain, the Escape Pain program has been brilliant at working in the MSK area. We also have a very psychology-based community pain service, which is developing new models, moving away from injectable interventions. We have the sexual health services, managing all the HIV, the MPOX, working right the way across Dorset, and we have a lot of work working with communities that are difficult to reach. You wouldn't walk into your clinic through mobile services. Specialist clinics, we have dermatology, community ENT, audiology, vasectomy, we have the CFS and ME. We currently have the post-COVID service, although like a lot of areas across the country, that is now being decommissioned, and we have podiatric surgery. Long COVID has been a major problem across the UK, and actually a lot of our staff are affected by it, so if you want to look after your staff, you have to make sure that, that you're looking after the COVID teams. Specialist therapy, we have heart failure, diabetes, leg ulcer, continence, community stroke and neuro, brain injury, SALT, and pulmonary rehab. Nursing and therapy, we have the district nurses, we have the community matrons, the integrated community rehab teams, the specialist leg services, the intermediate care, the CHC occupational therapy, and anticoagulation. And last but not least, we have the wheelchair service. So really what I'm trying to say is that if you want data, if you want joined up information about people to use in your research projects, Dorset HealthCare is a really good place to start, particularly if you're looking at moving care into the community, because we're doing that and we're passionate about doing it in a way that treats people equally and safely. Thank you.